The history of psychiatric treatment of homosexual individuals is a history of systematic violence, scientifically disguised torture, and institutionalized discrimination. What is now recognized as one of the most shameful chapters in medical history was, for decades, standard practice, scientific consensus, and socially accepted. People were tortured, mutilated, and destroyed not despite science, but in its name. Well into the 20th century, homosexuality was not only considered morally reprehensible and criminally prosecuted, but also classified as a psychiatric disorder. Its inclusion in diagnostic manuals like the American Psychiatric Association's DSM, Diagnostic and Statistical Manual of Mental Disorders, gave discrimination a veneer of scientific legitimacy. Those who loved someone of the same sex were not just criminals, but sick, and the sick could be treated even against their will. This logic opened the door to decades of systematic abuse. The World Health Organization didn't remove homosexuality from its disease classification until 1992, while the American Psychiatric Association acted in 1973, but even that came not from scientific insight, but after massive protests by activists. Until then, generations had suffered under a diagnosis that never rested on empirical foundations, but merely clothed social prejudice in medical language. So-called conversion or reparative therapies ranked among the cruelest practices. Their stated goal was to make homosexual people heterosexual, an objective that was never achieved but destroyed countless lives. The methods varied, but all shared an underlying brutality. In aversion therapy, patients were systematically conditioned to associate their own sexuality with pain and disgust. They were shown images of same-sex individuals or erotic scenes while being subjected to powerful electric shocks. The current was often set high enough to cause unbearable pain. Alternatively, they were injected with emetics or apomorphine, so they would literally become nauseated by their own desires. These procedures were repeated over weeks and months until the subjects were broken, not cured, but traumatized, often for the rest of their lives. Some facilities went even further, forcing homosexual men under the influence of drugs into heterosexual intercourse with prostitutes. The thinking behind this was perverse in its simplicity. If one intervened hard enough, sexual orientation could be reprogrammed. The psychological consequences of these rapes were devastating. Alan Turing, the man who was instrumental in breaking the Enigma code and helped end World War II, was convicted in 1952 for his homosexuality. He was given a choice, prison or chemical castration. He chose treatment. High doses of estrogen meant to suppress his sexual desire. The side effects were brutal: depression, breast development, physical weakness, infertility. 2 years later, Turing took his own life. His fate was not unique but exemplary of thousands. Chemical castration was standard practice in many countries. Men were pumped full of female hormones under the assumption that this would correct their deviant sexuality. With lesbian women, practitioners tried the opposite. Testosterone injections were supposed to restore natural femininity. The medical logic was absurd, but the consequences were real: physical damage, psychological breakdowns, and an alarmingly high suicide rate. Beyond this, homosexual people were exploited as test subjects for experimental medications. LSD experiments were meant to uncover the causes of homosexuality, while massive doses of sedatives and antipsychotics were intended to suppress deviant behavior. The subjects had no choice, no information, no consent. They were property of the institution. When psychological and chemical methods failed, which they inevitably did, some psychiatrists turned to the scalpel. The lobotomy, that barbaric procedure in which nerve pathways in the brain were severed, was also performed on homosexual individuals. Particularly those who refused to change their orientation or who were deemed especially obstinate were subjected to this procedure. The consequences were catastrophic: severe personality changes, cognitive impairments, complete apathy. Many became living shells of their former selves. In the 1970s, German neurosurgeon Fritz Roeder pushed even further. He performed operations on the hypothalamus, a part of the brain he believed responsible for sexual orientation. His patients had no choice. They were persuaded, pressured, or forcibly operated on. The results were devastating, scientifically worthless, yet Roeder continued his experiments. The power of psychiatric institutions was absolute. Families could commit their homosexual children, siblings, or spouses without their consent. Once inside the asylum, victims lost all rights. They were deemed incompetent, unable to object, unable to flee, unable to call for help. Stays often lasted years, sometimes decades. Some never came out. Conditions in these asylums were inhumane. Solitary confinement for months was not uncommon, a deliberate strategy to break people. Shame therapies, in which patients were exposed and humiliated before groups, were designed to force them to deny their sexuality. With the diagnosis came loss of everything outside the asylum too: jobs, homes, custody of children. They were declared second-class citizens, stigmatized, ostracized. In the United States, the Lavender Scare of the 1950s and 60s led to a veritable witch hunt. This lavender fear, running parallel to the anti-communist Red Scare of the McCarthy era, specifically targeted homosexuals in public service. They were viewed as security risks, vulnerable to blackmail by Soviet agents, morally corrupt. Thousands lost their jobs in government, military, and educational institutions, not just sick, but dangerous, according to the prevailing logic. Practices varied from country to country, but the underlying patterns were universal. In Britain, homosexuality remained criminal until 1967, and chemical castration was a common alternative to imprisonment. Alan Turing's fate stands symbolically for countless others whose names were never known. In Germany, Paragraph 175, which criminalized homosexual acts, remained in force even after 1945. In West Germany until 1969, in its harsher Nazi version, in East Germany until 1968. Those convicted often didn't go to prison but to psychiatric institutions, frequently the worse option. There they were treated, which meant tortured, medicated, broken. In the Soviet Union, homosexuality was both criminal and officially an illness. Victims ended up in labor camps or psychiatric facilities, where they suffered under inhuman conditions. Even in China today, psychiatry continues to be used as an instrument against sexual minorities. Even in more liberal societies like the Scandinavian countries or Switzerland, homosexual people were forcibly sterilized into the 1970s. The eugenics programs that reached their horrifying peak during the Nazi era continued in modified form for decades afterward. The guilt doesn't rest solely with individual sadists in white coats, but with the profession as a whole. The American Psychiatric Association defended the pathologization of homosexuality vehemently for decades. Psychiatrists built careers on promises to cure homosexuality, despite a success rate of 0 and devastating harm to their subjects. Academic journals published pseudoscientific studies that legitimized discrimination. Universities trained generations of therapists who perpetuated this violence. Only when gay and lesbian activists began disrupting conferences and applying public pressure in the early 1970s did the pathologization begin to crumble. The gay liberation movement following Stonewall in 1969, groups like the Gay Activists Alliance, and courageous individuals like Dr. John Fryer, who spoke anonymously as Dr. H. Anonymous, forced the profession to confront itself. The removal of homosexuality from the DSM in 1973 was not scientific progress but a political act, forced by those who had suffered for decades. The WHO followed only in 1992, nearly 2 decades later. Many professional organizations have since apologized. Some have established commissions to examine their past. Yet many victims never received compensation, never received acknowledgement of their suffering. The perpetrators, the psychiatrists, psychologists, and nurses who committed these crimes were rarely held accountable. Many retired without consequence. The damage inflicted by psychiatric treatment of homosexuals is immeasurable. Thousands took their own lives, whether during treatment, immediately afterward, or years later, traumatized and broken. Countless others spent years or decades in asylums, lost their best years, their careers, their families. Many never dared to live their sexuality again, married heterosexually, lived lives of denial and internal conflict. The psychological consequences extend far beyond those directly affected. Entire generations of LGBTQ people grew up knowing their existence was classified as illness, that they could be locked away at any moment, that science itself viewed them as defective. This trauma reverberates today in fears of therapists, in mistrust of medical institutions, in internalized shame and guilt. It would be comforting to believe all this belongs to the past, but the truth is more disturbing. Conversion therapies are still practiced worldwide, often in religious contexts, in evangelical communities, in conservative societies. In Germany, they've only been banned for minors since 2020. For adults, they remain legal as long as they're voluntary. But how voluntary is a decision made under massive social pressure, in coercive religious contexts, or in situations of existential despair? In many parts of the world, from Uganda to Russia to Malaysia, homosexuality is still criminalized and pathologized. The old justifications, it's an illness, a Western decadence, something curable, persist. The mechanisms of exclusion, medicalized violence, and institutionalized discrimination still function. Even in liberal societies, LGBTQ people still experience discrimination in healthcare. Therapists who don't acknowledge their identity, doctors who attribute health problems to their sexuality, clinics that provide inadequate care. The legacy of pathologization hasn't disappeared. It is merely transformed. The history of psychiatric treatment of homosexuals is not a footnote, not a regrettable error on the margins of medical history. It is a central chapter about how science can be abused to exercise power, how medical authority serves to legitimize violence, how social prejudices are translated into diagnostic categories. It teaches us that the definition of what counts as normal and what is sick is never neutral, but always reflects power relations. It shows that psychiatry is not inherently progressive or humane, but carries the values of its time and its actors. And it warns us to remain vigilant. Who is being pathologized today? Whose identity is being classified as a disorder? Who is being controlled, normalized, broken in the name of treatment? The victims of this history deserve more than apologies. They deserve recognition, compensation, remembrance, and we all owe them the commitment never to allow history to repeat itself, in whatever form it might take.